So I think the biggest challenge that we have at the moment is that we've got lots of different organisations working within the NHS, but those organisations don't always manage to collaborate closely around the needs of our patients and our citizens. I think this is a real big challenge because we all want to achieve the same goal, but we've got lots of different ways of doing it. The most efficient way to deliver care would be by coming together as closely as we can around the needs of that patient to provide exceptional service for those patient groups. I think what's been underestimated in a lot of the conversations that we're having is the actual patient voice. I think it's essential that we have the patient, their views, their carers' views at the centre of everything that we are trying to deliver. And that's so important if we're to try and get this right for the needs of that population. We need to sit and listen with what the main challenges are for those patients. I think technology is really helping change the way that we deliver care. We've now got access to patient clinical records, we've got access to blood tests, we can look after patients and monitor them remotely in ways that we couldn't do before. However, we need to make sure that digital transformation isn't just around the technology. It has to fit into the clinical pathways that ultimately can impact a patient in a really positive manner. It's essential that we don't just bring in a piece of technology and hope that it's going to transform the way we deliver care. We have to look at the pathways, look at the systems, look at the services first, and then bring in the digital technology to make sure that we don't add extra work and add or bring in delays for patients. I think it's so important to make sure we don't leave anyone behind as we start to redesign the way that we offer health and social care. It's so important that equity is considered in all we do, and if we want to make an impact, we have to make sure that those voices are at the table. I think an easy way to do that is to look around the room, that when you're having those meetings and when you're doing these processes of change management, does everyone look the same in that room? Do the people in that room represent the needs of the people that we're trying to serve? If they don't, then we've probably not got the right voices in the room. So in order to make sure we don't leave anyone behind, we've got to make sure that those voices that represent the patients and their needs and the needs of their carers are there.